Hey people, this is my sister Laura.
Hey, it's my sister Jean. We're the Reclamation Sisters, and today we're going to talk about PAWS, Post-acute withdrawal syndrome.
What do you know about it?
So the only thing I know about withdrawal is shaking and sweating and puking. Like when you see it like in TV shows and stuff.
True life. Yeah.
That's all that I would know about it. So what do we need to be aware of?
So like we talked about before, when you are going to come off of certain substances, whether it's prescribed or illicit, there's a process so that you are medically monitored so you're safe. And they give you comfort medication to kind of taper the process and make it easier. And so if it's alcohol, benzodiazepines, opiate use, you're put into detox setting. After that, you go into like an acute withdrawal, right? And so it's that first phase that your body is telling you, hey, I'm not happy with you. And so it's, and that's where you're like, yeah. So, you know, you're nauseous, you're vomiting, you're sweating. It's the response to not having the substance in your body and then it kind of coming through to the other side. But after that initial period, some drugs it's a couple days, some drugs it take, depends also on the use, a little bit of time. But after that acute withdrawal, you kind of stabilize. And then for a little while, you're like, okay, well, I'm not happy. But what happens is all of a sudden we go into post-acute withdrawal. And that is a cluster of symptoms that occur that are psychological and mood related. And they have a lot to do with if you have pre-existing co-occurring symptoms or syndromes, and also how you are physically and how you're coping with all of that. So this is what happens. You've gone to detox, you're through that acute medically critical period, and then you kind of stabilize out. And then all of a sudden you're like, okay, maybe I am okay or whatever. And then all of a sudden you're like, girl, it's not pretty, because you don't realize what's going on. So different substances create different issues in the post-acute withdrawal phase. But what family members need to know is it's whether it's street drugs or prescription. Like you could have been on a prescription for a long time. This syndrome will last anywhere from 1 year up to 18 months.
Oh my God, I had no idea.
Oh, it's terrifying.
And you mean like if you were on a prescription drug appropriately on that drug?
And so you would have to taper down on it. Anytime you've been on something for a long time, it's like when you don't eat sugar.
Oh, I don't know what that's like not to eat sugar.
But anytime you've had something in your body for a long time, you have to kind of slowly come off of it, So even if your doctor gave you a medicine and you were, say you needed something until you gained control of your body for a couple years, anytime you just stop taking something, your body's going to respond. And if you withdraw and you are tapered down appropriately so that you don't have, a significant amount of symptoms, you're still going to have symptoms. So here's the thing is, we don't really understand what people were using. People think they're using something and it may not be that, on the street, there's a lot of contamination. And nobody's really honest about how much they were using.
Well, yeah. And I don't understand that, but I totally believe that, having, gone through our situation. But what scares me, it's not really the drug that you think you're buying, because they're trying to get, to give you something cheaper, but it's fake and it's going to kill you, or it's like
all kinds of stuff.
Yeah. Terrible stories like that. And so you don't even really know what it is that is happening to your body.
You might think that you're doing heroin, right? Say the person was, packaging up other drugs, and then you go for a urine test and you're like, yeah, well, I do heroin, and all of a sudden they're like, and methamphetamine and cocaine, and you're like, but I don't do that.
Oh my God.
But the problem is if it's all on the same table, or they use the same items to shake it and, do the things, all the things, you're going to have cross-contamination. So you can swear up and down you didn't do it, but you did a drug, and so other drugs can be in it. So that creates further problems. So you've got this window of time. So I've come through, and now I'm like, okay. And then all of a sudden you're like, hey, what's wrong with Sally? So psychological, mood-related, physical symptoms, and it depends on what substance you were using. So alcohol, benzodiazepines, methamphetamines, cocaine, all create a different post-acute withdrawal cluster of symptoms. So with cocaine, you might have impulse control. Now your brain's not receiving all that dopamine, so you're depressed. You were not sleeping, so now you're oversleeping, things like that. And so you also have alcohol that you can have tremors, seizures, depression, fatigue, nausea, things like that. And then you've got other substances that are going to create maybe issues with psychosis or delirium or hallucinations or tremors or tactile sensations related to, like yeah.
Crawling on you.
Crawling, yeah. So what we have to, be cognizant of is I might be fine for a while and my skin may all of a sudden start to respond and I may have, poor skin or my hair might be not healthy and it might kind of start to break or whatever. The thing you have to realize is you don't know how your body's going to respond to something and you don't know how your body's going to heal. And it's actually the process of healing that you're going through. Your body has to reset. So post-acute withdrawal symptoms are often mistaken as, hey, are you doing something you shouldn't be? Like, why don't you feel good? Why are you sleeping so much? Why do you have a headache? You shouldn't be having a seizure. Why are you so depressed you're not on those chemicals? But, you could come off of antidepressants and have to switch medicine and you could go into a deeper depression. Like, you have to understand that just because somebody's having a response in that first 2 years doesn't mean they're using. You need to be educated on the fact that any substance creates crisis, and when you stop taking that, it creates another crisis. And so what's important to know is, as a supportive person or dealing with a friend or a family member, you need to be aware that they're going to go through an enormous amount of change. Remember, I gained horrifying amount of weight to the point where I had other physical problems because of insulin issues, and it was my body just rebelling. I had never had that problem, but I was sick. I was so heavy. It was
unrecognizably heavy.
Like Jabba the Hutt. Yeah. But it was absolutely in that time frame where my body just went, I'm going to show you what you did.
Yeah.
Ooh, I didn't understand any of that. I was like, well, that doesn't apply to me. I didn't do those things.
Yeah.
But I did something enough to my body where it was like, yeah.
You've been through so many stages and phases, and then it was that long period where I was like, it's not happening, or I don't care, so I don't remember exactly when it was, but I do feel like there was a time where I was convinced, and I don't remember if mom and dad were as well, probably, because they're always worried, that it was going to happen again, that we were like, here we go again, where we were so certain that you were just starting to get clean. And I'm assuming it was one of those times where it was like, because we were like, look at her skin, or look at her weight, or look at her mood, she's acting crazy and really jumpy. And it was, and so you just, as the family members, especially if you're living with or right around those people, you just start to doubt them. And sometimes, depending on the, the family dynamic, you might come right out aggressively blaming and accusing the person who's really not using, again, who's genuinely trying to get better and who's just suffering through these symptoms. And then, what's that going to do to that person who's in recovery, might drive them to actually start using again, because you might feel like, well, what the hell?
Nobody believes me.
Yeah, nobody believes me. Nobody's ever going to, think that I've actually stopped. What's the point? I don't have a support system, because here they are blaming me and accusing me again. Yeah, so I think as a sister, certainly it would have been nice to know that. But certainly if you're the parent who's living with somebody trying to recover, or the spouse, or whatever the situation is, to understand that, just going and jumping on them and accusing them of using again,
going to cause a little conflict.
It's going to cause conflict and maybe drive them in the wrong direction. But if we understand what's happening physically and emotionally with these people in recovery, then we're better able to, to support them instead of, make them, sort of drive them in the opposite direction again.
So some of the things is you'll be irritable, you'll be fatigued, you'll be having variations on how you eat, your weight, your skin, your hair, depression, anxiety, also executive function, not being able to remember. You'll get up and walk over and go to say something or go to get something, and you get there and then you don't remember, and you're like, great, and then you start to cry, and everybody's
that can happen when you're 46 too.
Well,
remember why I'm here. What am I supposed to be doing? Why did I come in here?
I don't know. So, but the other things is, you start to doubt those people, and then you start to doubt yourself. What did I do to myself? And it's really traumatic. And so you really need to just as a person in recovery, really understand what it is, but also as a person that's supportive, understand they're not doing any of this on purpose. They're not making choices to go backwards. It's the process of moving forward. It's those many paths to recovery require a period of wellness. And so a lot of times people are like, well, I got out of detox, or, you know, oh, you did 28 days of treatment. Why aren't you better?
Yeah.
Well, I need another 18 months to get myself settled. So it's just really a point, I guess, that nobody ever talks about. And a lot of people in treatment are like, you know, what are you talking about? So it's just essential that we are aware what people are going through. So
that we can support them better.
Yeah.
So that acronym again was called PAWS, PAWS, and it's post-acute withdrawal syndrome. So get educated. See you guys.
See you next time.
That will just be the also where I record.
Oh, do you need this, the white paper?
Well, like, yeah.
Behind you.
Paper.
Look at Nene, remembering all the we have to do. Thanks, Dad. Thanks, Dad. Bye, Justin. Bye, Dad. Thanks, Dad. Today we're going to talk about PAWS, post-acute withdrawal symptoms. Or no, syndromes?
Post-acute withdrawal syndrome.
Syndrome. Start again.